Percutaneous Endoscopic Gastrostomy, PEG. Introduction. Please point to the stomach. Choose one of the following options. Correct. Someone may need a PEG if they cannot swallow on their own. Select true or false. Correct. A gastrostomy tube is often placed because someone cannot eat enough or swallow on their own. Which of the following is the tube that goes from the nose and into the stomach? Choose one of the following options. 1. NG tube. 2. PEG tube. Correct. The NG tube or nasogastric tube is the tube that goes from the nose through the back of the mouth and into the stomach. Do patients usually have to stay at the healthcare facility for several days after a PEG placement surgery? Select yes or no. Correct. Patients can usually go home the day of the procedure or the next day. The risk of punching a hole in the intestines is common during the PEG procedure. Select true or false. Correct. Making a hole in any of the organs, such as the intestines, is very rare during a PEG operation. PEG tubes are never replaced. Select yes or no. Correct. Though PEG tubes can last for months or years, they eventually need to be replaced. Which of the following can be given through a PEG tube? Choose one of the following options. 1. Food. 2. Liquids. 3. Medications. 4. All of the above. Correct. Food, liquids, and medications can be given through the PEG tube. Thank you for using Explain.